Assalamu alaikum wa rahmatullahi wa barakatuh. In this lecture, I will talk about the vessels of the upper limb. The subclavian arteries carry the arterial supply to the upper limb. Here we can see the origin of the right and left subclavian arteries. This is the arch of aorta. It gives off three major branches: brachiocephalic artery, left common carotid, and left subclavian. The brachiocephalic artery gives off the right subclavian and the right common carotid. So the right subclavian artery is a branch of the brachiocephalic, but the left subclavian is a direct branch from the arch of aorta. Each subclavian artery crosses the outer border of the first rib into the axilla. It changes its name into axillary artery. The axillary artery passes into the arm as a brachial artery. The brachial artery terminates at the upper part of the front of the forearm by dividing into the radial artery laterally and the ulnar artery medially. Both radial and ulnar arteries carry the blood supply to the forearm and hand. The axillary artery is a large blood vessel that conveys blood to the lateral aspect of the thorax, axilla, and the upper limb. In this figure, we can see the distribution of the axillary artery. As we said before, axillary artery begins at the outer margin of the first rib as a continuation of the subclavian artery. It courses into the axilla. Then after passing the lower margin of the teres major muscle or the lower margin of the axilla, it becomes the brachial artery. Along its course, the pectoralis minor muscle divides the axillary artery into three parts. This is the first part, proximal to the pectoralis minor, and it gives off one branch, the superior thoracic artery. This part is the second part of the axillary artery behind the pectoralis minor, and it gives off two branches, the acromiothoracic and the lateral thoracic arteries. This part is the lateral part of the axillary artery. It gives off three branches. Two of them turn around the surgical neck of the humerus, forming an important anastomosis. They are the anterior circumflex humeral and the posterior circumflex humeral arteries. The last branch is the subscapular artery that went around the subscapularis muscle. The right axillary artery pulsation could be felt against the lower lateral part of the axilla, against the humerus, after abducting the arm to be at the right angle with the trunk. The axillary artery can be safely clamped without any danger to the arm, but only in a location just proximal to the origin of the subscapular artery, and at the same time it is distal to the subclavian artery, so the anastomotic network around the scapula can provide an alternate path for collateral circulation to the arm. The right axillary artery is often used as an arterial cannulation site, especially in the cardiac surgeries. Now the brachial artery, which is a continuation of the axillary artery, it passes in the arm superficially, I mean just below the deep fascia, and it terminates at the level of the neck of the radius by dividing it into two terminal branches, the radial and the ulnar arteries. The branches of the brachial artery include one large branch passes to the posterior compartment of the arm, which is the deep brachial or the profunda brachii artery. Also, it gives the superior ulnar collateral and the inferior ulnar collateral arteries, plus numerous nutrient arteries to the humerus. The pulsation of the brachial artery can be felt here in the anterior aspect of the elbow, just medial to the tendon of the biceps muscle. It is a landmark for the brachial artery, and its pulsation is needed with the use of a stethoscope or sphygmomanometer. Now the radial and the ulnar arteries, which are the two terminal branches of the brachial artery. The ulnar artery passes along the medial side of the front of the forearm, and it enters the hand superficial to the flexor retinaculum. Then it winds laterally, forming the superficial palmar arch that is closed on the lateral side by the superficial palmar branch of the radial. The radial artery passes along the lateral side of the forearm, and it winds around the lateral aspect of the wrist. It enters the anatomical snuff box, then again winds medially to form the deep palmar arch that is joined by the deep palmar branch of ulnar. The radial artery pulse can be felt in two sites. The commonest site is the lateral to the flexor carpi radialis tendon in the front of the lower part of the forearm against the shaft of the radius. The second site is the pulsation, is the feeling its pulsation in the anatomical snuff box, and the radial artery can be felt against the scaphoid bone. Peripheral pulses can be felt at 6 locations in the upper limb. One location or one site for the axillary artery, 2 sites for the brachial artery, 2 sites for the radial artery, and 1 site for the ulnar artery. Axillary pulse can be felt in the axilla against the shaft of the humerus. After abducting the arm, we can feel the axillary pulse at the lower lateral wall of the axilla. The brachial pulse can be felt either in the mid-arm, in the cleft between the biceps and the triceps, or in the cubital fossa, medial to the tendon of the biceps brachii muscle. The radial pulse can be felt in the distal forearm, just lateral to the flexor carpi radialis tendon, or can be felt in the anatomical snuff box at the lateral aspect of the wrist against the scaphoid. The ulnar pulse can be felt in the distal forearm, immediately proximal to the pisiform bone and lateral to the tendon of the flexor carpi ulnaris muscle.